Hi, everyone. Hey, we're recording now. Hello, my name is Stacy Nell. I'm the Executive Director of the Kansas African American Affairs Commission, and we're here with another Lunch and Learn. I am thrilled to be joined by, wait a minute, I know how to say it. It's Cherayla, like with a ray of sunshine. Yes, Cherayla Haynes. I remembered you giving me that hint with Frontiers CTSI is joining us today. And we have a lot to cover because I'm going to have her do a lot of explaining. So Cherayla, welcome.
Thank you so much, Stacy. It is a pleasure to be here. I have been watching some of these Lunch and Learns for a while, and so I'm excited to be a guest.
Fantastic. All right. So, here's one question I didn't tell you I was going to ask you. What did you have for lunch, since this is a Lunch and Learn?
So I did not really eat a proper lunch. I am currently drinking the chocolate milk from a kids meal from a fast food restaurant. I didn't eat any of the food. I'm going to give it to my kids when I pick them up, but I am drinking some of the chocolate milk. So.
Okay. Interesting.
What about you?
We'll discuss it. Well, I mean, I just had like a frozen meal, like one of those.
It's not that much better than me.
Yeah, it's called Purple Carrot, and they had like this stuff. It's like a vegan with high protein type situation. Yeah. And then I had some peanuts, some salted peanuts as a snack.
Okay, I have my water.
There you go. I've got water. Okay. And on that happy note, let's get down to business. All right, now, Cherayla. Now you here a little baby bio is a community partner project manager for Frontiers CTSI. Before that, she worked with KU's Medical Center since 2015 as a residency and fellowship coordinator. She supported physical and medicine rehabilitation residency and fellowship programs. Before that, she was an executive assistant at the University Health, formerly Truman Medical Center. The majority of her time has been in healthcare, has spent at the graduate medical education. And she was an internal medicine residency coordinator for 5 years, more than 5 years, at Memorial Sloan Kettering Cancer Center. So welcome.
Yes. Thank you for the bio. I appreciate it.
You're welcome. I have to tell people who you are. All right. So now you are the community partner project manager for Frontiers CTSI. First of all, what is Frontiers? This was a new organization for me. So give us the background.
Well, please try to say that 3 times fast. That's what I would like. Community Partners Project Manager for Frontiers CTSI. I've been saying it for a while, so I'm used to it. But Frontiers CTSI, that is an acronym for the Clinical Translational Science Institute. We are funded by the NIH, the National Institute of Health, for 5 years, and we are on our 3rd cycle of 5 years. So we've been around for over 10 years. Our job is to accelerate research from the lab, from the community engagement, from ideas into innovations that actually help people. That's the tagline, just accelerating research, making translational research real. So one thing that I do want to point out that is of importance is even though I'm housed at KU Med, we have partner institutions that are Kansas City University or KCU, Children's Mercy, Kansas State University, KU Lawrence, the University of Health, Kansas Health System, UMKC, and St. Luke's. So the way that works briefly is that the money comes from the NIH. I shouldn't have put money in quotes because it's real. The money comes from the NIH and it comes to KU Med, and we are the administrative team that sends it out to the partner institution so that we can all practice translational science and move it regionally. So our catchment area includes Kansas, because we are KU Med, and Missouri, all the way till you get to Columbia, Missouri. And then the other CTSI on the other side of the state takes over from that point. So that's a high level overview of what Frontiers is. We can dive deeper into like what my role is and all of those things.
Well, I mean, we will. So the money is not in quotes because we are talking about a large share of money. Because if KU Med is the one who's housing the money that goes to K-State or KU or, that's we're talking about some real money, not in air quotes. So yes, your job as a community partner project manager, what is your role within Frontiers?
So the best way for me to describe Frontiers' cores. So if you think about a large company or organization and they have departments, so we call them cores. For all intents and purposes, I'll just call it a department. So we have departments like biostatistics or healthcare integration, genomics, all the things that researchers need to push their research forward. The one that I am a part of is community and collaboration. That is a core that has two offshoots. One of them is community engagement. The other is team science. We work together for community and collaboration to occur. My role is to ensure that there is a liaison between community investigators, community advocates, and researchers or investigators. That I use those words interchangeably. So forgive me if I use one more than the other, but the researchers / investigators will ask a question about, I'm interested in seeking out how the Latino population responds to a certain medication, but I don't know how to reach the Latino population. So then my job is to ask them, if you don't know how to reach anyone in the Latino population, have you volunteered in that community? What have you done in that community? It's not, oh, well, here's a person that you can access and you can give them your, your survey, your protocol, your treatments. My job is to make sure that there's actual bidirectional communication between these community groups and community advocates and investigators, and that the relationship doesn't end when the project ends, but that we maintain. It's one of the things that the NIH is really proud that they are putting money in back of, because there was a time when community engagement was just thought of as a soft science. Oh, it's something they're doing in the background. We don't really know what they're doing, but they've actually put money into community engagement to make sure that these investigators are no longer pillaging communities and then leaving. So my job is to make sure that doesn't happen, along with supporting the administrative team. We all work really well together. There's a team of 12 of us that all work in different departments. We have grant writers and communication specialists and recruitment specialists and people that really specialize in pilot awards and all those things. And so all of us work together. Like we have a research day in the spring. So all of us, all hands on deck, trying to make sure that not only the community piece is taken care of, but that every investigator, every researcher, every person that comes to the door leaves with something from research day that is sponsored by Frontiers.
Do you have like an example of like a success story from the past where, like you said before, a researcher or a research institution might just want to come in and swoop in and do research and swoop out, but now there's someone that you've been working with that has remained in the community?
I think the best person, Dr. Alan Greiner has so many stories like this, and he has been doing this much longer than me, so his stories go back pretty far. But I can tell you about, there was a time when an investigator wanted to do a stroke, a protocol or a survey, and they wanted people to come in person to do some type of physical activity. They would monitor them and all the things. And so with this idea, with this project that they had, we suggested that they run it by our community advocates. There's a group of people within Frontiers that you can, we call it a rapid reactor panel, name to be determined. But you have about 5 minutes to describe your project. They give you feedback on what they think, and then you go from there. So one of them said, where do you plan to house this, this session? And they explained where it was. And they said, well, aren't there stairs to get into that building? I don't think it's ADA compliant. And everyone did a quick Google search. And the investigator just like sat back and was flabbergasted that they had not even considered that people would have an issue up these 2 stairs to get into the session. And so you're cutting yourself off at the knees. Like, let's find an ADA compliant building where people can get in if they need to. So that's one example of how community engagement can work with research in an immediate way, but there's much more long-term examples of how these relationships are built and cultivated. Just like Juntos is one of our partners within KU, and they have really close ties to their community, to the Latino radio station. And those things took years to develop, for people to actually trust what you're saying on the radio about clinical trials, what they're putting in the newspaper about this is a health fair. We don't want anything but to just give you screenings, diabetes screenings, healthcare, like all the things that you need, just so you could know Frontiers and Juntos are not here to take from you, but to give as well.
See, I think, that's just such an wonderful argument or
Mhm.
evidence for why it's important to have community. If any project is going on, to have people who are sort of close to the ground to say,
Mhm.
I don't think that building's ADA compliant. That takes someone from the community to know. So yeah,
Yeah.
that's cool. That's cool. Okay, so who is your audience like for the work that you do? Because it's not necessarily, and we've talked about this at length, just in case
Yes.
it may sound like a crazy question or how to phrase it, because we've talked about this for at least an hour, because I'm trying to wrap my head around it, the work that
Yeah.
you do. Because who is your audience? Sure, KU Med or K State's research is your audience, but also there are people close to the ground.
Mhm.
One might be Shalise Clay. We'll get to her a little later, but there are people close to the ground who may have ideas about how to help their community, who potentially might be an investigator in your
Mhm.
program.
Yeah. It is, my audience is literally anyone interested in research, which sounds so broad. So right now we are recruiting for well, actually, we just stopped recruitment for our community advisory board. We revamped our old community advisory board, and my promo, all the things that I would put out is, if you're interested in research, let me know. I would love to talk to you about what part of it interests you. How can you be involved with Frontiers and give us your expertise and insight? And so there's multiple parts of who my audience is. So number one, the audience would be community. In the time that I've been in this role, I have really tried to reach out to different parts of Kansas City, Missouri, and Kansas City, Kansas, and find out who are the leaders in different areas that are a part of healthcare equity, are a part of the social determinants of health, getting in touch with all of those people that are attacking it from the ground. So then you're going to combine that with our public health departments. So there are sometimes medical relationships between the health departments and big institutions. There are medical directors that usually have a job within these big institutions that are also in the public health departments in the region. But I think that the community engagement piece was missing. So now we have community advocates and we have public health departments. And now we move on to other investigators and researchers. So when they are talking about their projects, it's my job to say, oh, hey, have you thought about reaching out to Latanya Liprin? It sounds like a lupus project, and she specializes in Black women and lupus. Let me give you her contact information so you can bring her onto your project. And at some point, we would like to have more community members as co-PIs or co-principal investigators, that they are an active part in receiving funding as well. Like the big grants that these researchers get, they should be co-PIing, I made it a verb instead of a noun. They should be able to collaborate and practice team
Right.
science with people in the community in some way, shape, or form. It doesn't have to be, oh, they're my co-PI, but they should be involved. They should be a part of that research if that's the community that you're interested in doing. So it's three-pronged. It's
Okay.
community advocates, it's public health departments, and it's investigators within our catchment area, letting them know that we exist and how we can help them accelerate research from an idea to actual things that help people.
Right. And I think that when I first when I first became aware of you and Frontiers and the work, it's because I was at KU Med's their Juneteenth, and they
Yeah.
had like a health fair type situation, and or just like a community fair. So I went with my CAC hat on and set up a CAC table, and we're just sort of walking around. So I think because I would imagine that there are people who are doing the work close to the ground, right? Who
Yeah.
have a question. Like, I wonder what would be a better way, or if I could reach more people, or gosh, I keep seeing this pattern. What does that pattern mean? They may not know. So I think if a person has a question and wants to do some research. So if a person has a question, they would have some sort of formalized research. Is it a formalized research project? Or like if you wanted to talk about, is it Latanya Liprin? I just
Yes.
lost
Latanya
her
Liprin.
name. Yeah, or like Shalise Clay, because I know I just recently talked to Shalise. She was the last person who was on my Lunch and Learn. So how does it, because those are individuals who are just doing work close to the ground. They're out there just doing the Lord's work. And if they get on your radar, or if you get on their radar, how do those things overlap? Because I know that Shalise was operating for a while before she knew about Frontiers. Yeah. So how does that?
I feel like all of my answers have all of your questions have multiple answers. So just bear with me as I go
Sure.
through this journey. So this is two-pronged. This is a two answer. So one answer is we currently have the Broderick Crawford Community Partnership Award. It's a mini grant. It is not big. It's $2,500. We give it to community members and researchers, and I'm putting that in quotes because community members are researchers from my point of view, but typically someone who is early career or mid-career to establish or strengthen their relationship. So someone like Shalise Clay might link up with Dr. Charla Smith because they both are involved with Black maternal health. So if Dr. Smith wants to do a project within a certain community, then she and Shalise may apply for that grant together, and that money will most likely go to Shalise's company, right, to her nonprofit, so that they can continue to do the work that they either want to do or have it envisions to do. Maybe they're already doing it. They may already be holding sessions, and now they just have this extra money to get food, transportation.
And I think I want to back up because I think at one point you said about putting investigator and researcher in air quotes to drive home the point that it's not like Dr. Charla Smith is a clinical researcher. Like she is Dr. Charla Smith.
Yes.
But Shalise is a community person who just loves her community and is trying to work. So it's just that, oh, hello, the lights came on. that Shalise.
There we go. They went off, but it did make.
Oh, is that better. What happened? Oh,
yes. I'm not moving around enough.
Yeah, yeah. Okay. But to not think, oh, if I'm not a clinical researcher with a doctor in front of my name and letters after my name, who currently is working at K-State's technical college or KU's medical, that it's not it, that this could be. Those are researchers, but in your definition, researchers could also be, I'm already working in the community, I'm already doing this work, and I have a question that I want to answer. I think I wanted to back up and make that clear.
I'm so glad you did that. Because if you ever have given a survey at one of your events, you are a researcher. Like you're collecting data. You're using that data to inform future decisions. And that's basically what researchers do. They just collect data, and then they say, okay, well, let's move forward with this. And they collect more data. Let's move forward. And so our job is to accelerate that process. Like if money is an issue, how can we connect you with grants? Very rarely do we actually give out money. So this is rare. The Broderick Crawford Award and our pilot awards are two examples of money that Frontiers actually is allowed by the NIH to give. Other ways that we do that is to connect you with grants. So if you subscribe to our newsletter and you became a member, you can decide, I only want to know about money. So just send me the only things about grants and money that's coming to that's available. And then other people, they can choose whatever they want to do. I want to only hear about community engagement, or I only want to hear about best practices within research, or I only want to hear about genomics, right? But yeah, so if we can help accelerate that for these people that are doing research on their own, then that's the goal. Again, the Broderick Crawford Award will probably be pretty competitive this year. Again, and it's small, it's not huge, but not only is it this $2,500 grant, but then you're connected into the Frontiers universe.
Ecosystem. Yeah.
Yes, the ecosystem. And we really would like to make sure that we spread the word about what the projects are that our awardees are doing. So 3 of our awardees will be speaking at the Heartland Health Equity Conference in September because they won the award. We want to hear about what they're doing and all of that. And I think that being able to get the word out about their project to these other people at the conference is a bonus or a benefit without them having to pay the cost or whatever. I do want to say the second thing about that too, but if you want to double down on anything there, then
no, go ahead.
The second thing I think that's really important to note is that we don't have a mechanism for community advocates to say, this is an issue in my community, how can I do research about it? Like if someone that doesn't have a nonprofit, or someone that is not in the community, but they're just like, hey, everybody from my town has the same kind of cancer. Can somebody come do something? We don't have a mechanism in place for that. And we are working on how we can, what part of community engagement does that take Is it just, something on our website? Is it people going out, like providing a QR code to enter this information? I never want to make it seem like Frontiers is perfect. Like, we are not, and we have a lot of work to do, in multiple areas, but community engagement is one of them, as I think a lot of CTSIs across the country have work to do. Because so many people have been doing this research without considering community engagement, that now for some people it feels like a burden to them to have to consider it, or to even consider considering it. That's a weirdly worded sentence, but I think you know what I mean.
Yeah.
And so to answer your question, it's two things. It's the Broderick Crawford Award, which I'm very proud of. We gave our inaugural awards last fall, and then we are working on providing a mechanism for people to be able to say, this is an issue. Can someone come out here and do some data? Take my blood. What's going on? So
no, that would be, I could see how that would be very helpful. I could see how that would be very helpful. And just, we've been talking about the Broderick Crawford Award. Anyone in Wyandotte County has heard that name. When I first got this job in 2021, with all the work around COVID and vaccine distribution, Broderick Crawford was a staple in terms of community involvement, and in talking about a man who knew his community deeply and was deeply invested in helping improve the health quality of his community. We lost him, sadly. I guess it must have been like a year or so, probably a little over a year or so now. And just devastating news. I didn't even know him well, but he was such a staple in the health equity space, in the health access space. And so to name an award after him is important. And to your point, or to the point I was trying to make earlier, I don't believe he was a doctor.
No, he was the first, to my knowledge, the first community co-PI on a big project, and it was about COVID.
Yeah. So he was just a man.
He should not be the last community principal investigator. He should not be. There are so many other people that are just as driven in all the things in their community.
Yep, he was just a man who loved his community and wanted to see people do better. So I wanted to, in case anyone's out there listening who's like, man, I really want to do right by my community, but I don't have all my fancy degrees. This was just a man who loved the people around him, and we're trying to help him. So yes,
and his
definitely.
gift made room for him. His gift elevated him. So whatever you decide to do, if there's an issue and you see that you can do a small thing to fix it, please do. You just don't know what the universe is conspiring to make sure and pave the way for you once you start to actually do the work. I am a spiritual person. And so I definitely believe that when you start to do the thing, then chips fall into place. It's not easy, like by any means, but if you have an idea, execute it. It's never too late. And you're never too old either. I tell people that all the time. They're like, well, I just started my nonprofit and I'm older. And I'm like, so what? Come on, let's do this work. I'm gonna hook you up with some people that maybe have more energy than you, but you would be surprised that some of these older people, they run circles around these younger people.
You know what I'm saying?
Yes.
They're like, I only have a certain amount of time on this earth and I'm gonna get something done. You mentioned membership. So talk to me about membership. Like, is it a cost to be a member? What does that entail to be a member?
Membership with Frontiers is it's a new model that we just started last year, where we used to just send newsletters to everyone, but instead of sending newsletters and grant opportunities, instead we scrapped that and asked that people become a member by going to our website, filling in the information that you're interested in knowing about. As mentioned earlier, like if you only want grant opportunities, just click that box and that's all you'll get. Or if you want everything, you're like, I'm hungry for everything research associated, then click all the boxes. Membership means that you have access to be able to have consultations with any one of the administrative staff, any one of our navigators across the Frontiers, any one of our partner institutions. Most of the consultations that we do, I mean, there are people that aren't members that I have consulted with, right? But it's helpful for us to be able to track information. And if a research project comes out of the consultation that we had, there is a follow-up survey that's sent a year later to ask, like, hey, what became of this conversation you had with Cherayla? How did it benefit the community? How did it benefit research and all things like that? It's no cost, as mentioned. It really is just a way to track what you're interested in knowing about and a way to accelerate research to get you to know what's going on in the community, what's going on in the research community, regionally, nationally, internationally. There's all kinds of stuff in our newsletters. And so, yeah.
Very cool. Very cool. So for you to become a member. All right. Fantastic. So this has been a lot of good information, and it's a lot of information that is, it's kind of nichey, but I'm like, wow,
Yeah.
I'm so glad I've learned about you. I'm glad I learned that this existed. And I'm glad we've had a couple conversations, so it sits better in my brain about what's the kind of work that you do. Yeah. So if people need to contact you, what should they do? How should they contact you?
Email is great. I am at CHAYNES@kumc.edu. And can I make a plug for one thing?
Sure. Yeah. Plug away.
Within the Community and Collaboration Group, CORE, we have a group called the Multidisciplinary Advocates and Researchers Group, or MARG for short. We meet every third Thursday virtually, and in those meetings, we talk about, we generally have a presenter come and talk about best practices for things going on in the community. We've had things from Black maternal health to how to use text messaging systems to reach underserved populations, to someone called in all the way from South America because they were a part of this mission trip where they helped people eliminate some type of really rare disease that was in this town. Right. It's always an interesting thing. And if you would like to do that, please contact me. We have a listserv of over like 150 people, but regularly it's about 30 to 40 people that show up. Some of the people are there every single Thursday, every third Thursday, every month. But there are others that they pop in when something's interesting and I don't see them again for a year. And they say, oh, this is interesting. I want to do that. So if you'd like to get on that invitation, then please contact me. Or if you're like, that sounds interesting, tell me more. I'm happy to tell you more about what we do, what previous presentations are like, and how we meet in person quarterly so that we can do a meet and greet. Now, the meet and greet started during COVID because everything was so virtual. So once we got the clear to meet in person, we started meeting in one time we met at a bar. Another time we met in Lawrence at the Cider Art Gallery. Another time we met in a community center. And so we do try to meet in person to create the environment for networking to happen with community investigators. So that's one of my babies. I love the MAR group, and I love to add people to it so that they can see, oh my gosh, there's so much going on I didn't know about, and they can get plugged in a different way.
You got it. And so that information is not like they'd have to contact you and say, get me on that list, or is it online someplace?
And it is, it is on our Frontiers website, which, frontierctsi.org, it's there as well, but it's kind of buried. Our website is so chock full of stuff. It's hard to find things sometimes, although you could do a search as well. But yeah, the MARG.
Okay. I will make a note to make sure that's in our description box in YouTube, and I'll conclude the links. Well, we are almost at 30 minutes. Can you believe it?
What?
It just goes so
fast.
28 minutes and 23 seconds right now. Okay. So in this job that I have, I've had the opportunity to meet a bunch of people that I didn't even know that their job existed. I didn't know that there was even these opportunities to have any of this stuff going on. So I'm thankful that you came on. I hope that this is information that can help someone realize that they too are an investigator. They too are doing research. If you, like she said, if you've ever put out a survey and collected information and made decisions based on that, you are a researcher. I guess I'm a researcher to an extent.
You are.
I've done some research myself.
That's what I'm saying.
But like, how can I?
It seems so overwhelming to people, but it's like, no, if you've ever done that, even if it's a 2-question survey and you made a change based on that information, you just did science.
There you go. Mm-hmm. I love it. Okay. But yeah, so I will, when I post this, I will make sure that all of your information is in the description and people can contact you. Yes. And I guess that's pretty much it for us today, everybody. I do appreciate you taking a half an hour out of your day to learn something new about how you can help yourself and the community. And we will see you next time.
All right. Thank you, Stacy. This was a pleasure.
Thanks. Bye.